Hi, I'm Dr. Farley. I'm a prosthodontist over at Revive Dental Implant Center, and today I want to talk about replacing teeth. So you may already be missing a tooth, and that's why you're watching the video, but you might also have some teeth that are not doing well, and you may already know, or we might give you that bad news that a tooth cannot be saved and it's time to have it extracted, and now you're gonna be looking at those different options. So I've got these models that I plan to use to help explain these different options. I've intentionally left an imaginary line here where this is one option and this is another. I'm going to start by just talking about when you're missing a single tooth or maybe a couple extra teeth. But in bottom line is you still have some of your own natural teeth. Whereas later, I'm going to go into the options here. And this is if you're losing all of your teeth or your teeth are already gone and you're just looking for what are the different options and some pros and cons to consider. So starting off with the situation where you're still going to be keeping some of your teeth, but you're missing some teeth. There's different options, and one of them is dental implants. So dental implants are a fantastic way to replace a missing tooth. Why? Because it doesn't affect the other teeth in your mouth. You can focus on just replacing the missing tooth, and the teeth around it don't get affected. Okay, that'll make more sense in a second. On my model, I've got an example of that. So this person's missing their front tooth, and the dental implant, it's just like, it's essentially a metal screw that goes into the bone and provides a foundation, okay, support. And on top of that, you can take a crown and attach it to the implant, and it looks like you have all your teeth back. You can floss it just like any other tooth. You can clean it, eat with it. Everything goes right back to how it was when you had your natural teeth. And that's the value, is with dental implants, things are firm, meaning they're stable, they're not going to fall out. You treat them just like a normal tooth, and it's great. It's literally the best way we have to replace a tooth to make it like you never lost the tooth, okay? Because the next best alternative is a bridge. So here's an example where this person is missing one tooth, but to replace it, it is affecting the teeth on either side. And so the teeth on either side need to have a crown done, which means you got to reduce the tooth, kind of grind it down about 1.5 millimeters all the way around. And then you end up with 3 teeth all connected together, and it gets cemented onto the teeth on either side. So obviously that's going to affect the teeth on either side, whereas the implant option avoided that. But the other thing is cleaning around a bridge presents with some challenges. You can floss on the front and the back of the bridge, but where that one tooth is missing, you can't just run floss in there. You have to get it into that space with special tools. And so it does mean that, your life has some extra challenges to it. But other than that, if it's still staying in your mouth all the time, meaning it won't fall out, it's there, it's very nice. It's still a great option for somebody who doesn't want or is not a candidate for a dental implant and wants a fixed option. Now, the other thing about this option is it needs to have a tooth on either side of the one that's missing. If this person is missing the back teeth and there's not a back tooth for support, well, then you can't really use a bridge to solve that problem, and then you're looking at dental implants. The other thing to consider is, because this is using these teeth for support, if you're missing a lot of teeth in a row, like this other side here, on this side, there's 3 teeth missing. If you were to think, well, I'll just use this tooth here in the back and the tooth here in the front, and I'll replace all 3 of these missing teeth with a bridge, that's not going to work. The engineering doesn't make sense, and you're going to break something by overloading these 2 teeth that are providing that support. And so in a situation like that, a great alternative is dental implants, where you can use 2 dental implants to support a bridge that has 3 total teeth in it. That's a great way of replacing 3 teeth all in a row. So as you can see, the situation really does determine what options you have. But the main difference between the implant and the bridge route is that the implant is all by itself, not affecting the teeth on either side, whereas the bridge does need that support from the other teeth, so those teeth do need work done on them. So if they needed crowns anyway, maybe a bridge is something that you're more interested in. But if you've got healthy teeth on either side, you're not going to want to go with a bridge. You're going to want to consider a dental implant. Now, let's say that you want the last option. Okay, the last option is not anything like this one. I don't even have a model for it, but it's something called a partial denture. So just like dentures come in and out and you got to take it out at the end of the day and put it in water, a partial denture is a removable appliance that has some teeth in it. Usually there's a metal framework to it that sits on the roof of your mouth or behind, kind of down where your tongue is. And that's where it gets its support and strength. But with this option, it needs to rest on good, healthy teeth for that to work. And where it rests on those good, healthy teeth, we do have to create a little notch in the tooth. So you do have to grind on the teeth, the ones that you have and that you're planning to keep. You have to grind on them a little bit, and it'll have like metal clasps that will grab onto those teeth for the support. So as you can see, there's not a lot of pros to a removable partial denture. The only one really is cost, but it's an option that you have to consider. So that's that. And if you have more questions about replacing some teeth while keeping other teeth, come see us. Come do a consultation with us and we can get into your specific situation. But for now, what I want to do is I want to go into this other category. Some people are at a point in their life where they are facing that hard fact that it's time to take out the last of whatever teeth remain. Or you've already been through that and you might already be in a denture and you're looking for alternatives. So I want to talk about the different options that exist for somebody who's replacing a full set of teeth, whether it's on implants or not, okay? So I've got these models here. This first one, this is just a standard denture, okay? Dentures have been around for many, many years. The premise behind it is that we build a prosthetic and it is made to look like natural teeth, and we can do that just fine. We can make it look really good. That is a pro, okay? A con to a denture is everything else about the denture. It is only supported by your gums, so it sits in your mouth, sitting on the gums, often needing adhesive to make it stay more stable. And because it just sits on the gums and is sometimes being held in with adhesives, there is always that opportunity for embarrassment if it were to move when you're in the middle of something or even fall out of your mouth. So that's something that you would want to consider. But the other thing about a denture is because it's getting its support from your gums, you are not able to eat the kinds of food you can with something that is fixed, okay? What that means is 20–30% is all that's left of your ability to chew. So if you look at 100 different foods out in front of you, you might be able to eat 20 or 30 of them, and the other ones are too hard or too gritty, too thin, like lettuce. So depending on what your goals are, that is how you're going to determine if a denture is going to be something that you are happy with, that gives you the quality of life that you're looking for. Okay, so that's a denture. One step up from a denture is still a denture, but instead of only relying on adhesives for the denture to stay in, you use dental implants. So it's still a removable appliance. I have an example here. This is an example of a lower, what we call an overdenture or a snap-in denture. And an overdenture uses implants, but just as an anchor, similar to how you get a tail hitch on the back of a truck and you attach things to it. There's attachments that are placed on the implants and inside the denture. So when the denture goes in and it snaps into place, now you can maybe hear that, but it still moves, it still wiggles, and food still gets under it. But when it's down, it doesn't want to float around in your mouth like a normal denture might. And so some people even still use adhesives with these because they want even more stability than what they can get from just the two implants. If this is done in an upper jaw, 2 is not enough. You need more implants in an upper jaw to have a snap-in denture. And for that reason, usually the cost starts to get close to the other alternative. And so usually when cost starts getting close to this, everyone makes the jump, because this is the final option to discuss. This is what you call fixed teeth, or a fixed denture, or an all-on-4, hybrid. There's a lot of names it goes by. But the idea here is that when all's said and done, and you are completely done with your treatment, this option, it's fixed. You don't take it out at night. You don't take it out ever. It stays in all the time, and it allows you to live your life as close as possible to how you used to live your life when you had your natural teeth. And so that's the biggest thing you're going to want to look at when this is something that you're considering, is quality of life. You know, what can I have that will give me all of my teeth, but allow me to eat whatever I want to eat, leave my teeth in when I go to bed at night, not experience embarrassment because something is moving, not deal with the annoyance of food getting underneath the denture while eating. It is just literally the best way we have in our profession to help you get a whole set of teeth back. I hope that helped you understand your different options. If you want to know if you're a candidate for any of these options, please just come and meet us for a consultation. They're free, but it gives us a chance to understand your situation better, but to also answer any further questions you have.